I'm Dr. Rich Winkelmann, a dermatologist and Mohs surgeon in Southern California. I'm here today to review the Spoke Evacuation in Dermatology survey article from the Skin Journal. The publication is from the Indiana University School of Medicine, and it's a survey of the Association of Professors in Dermatology. The survey was sent out. There were 85 respondents, and the goal was to inquire about their use of spoke evacuators with surgical procedures. This is a big issue because, there have been papers in recent years talking about the mutagenic aspects of smoke, from surgical procedures, and they found it to have, the carcinogenic potential of 3 to 6 unfiltered cigarettes. There also is the theoretical transmission of HPV and several other, viruses and bacteria that are considerations as well. And so one of the weaknesses of the study was that they didn't indicate the response rate, but there were 85 respondents of the Association of Professors of Dermatology, and it was found that 28% of them consistently used spoke evacuators during surgical procedures. Of this group, they tried to separate out between age, gender, and they really couldn't find any statistical significance between the two groups, except they did find that dermatologists that were in practice 10 plus years were 2.8 times more likely to use spoke evacuators than younger dermatologists. So possibly because of the experience over time. They know that they don't want that in their operating rooms. Patients don't either. They also gauged just factors that were limiting to using spoke evacuators in clinic. And as a Mohs surgeon myself, there's a lot of the things that I struggle with. There's staff knowing how to use it. There's setup time. There's the fact that there aren't really any hands-free evacuators out there, and so these are the things that they're going to keep us from using in our clinic, and also education. If more people knew about this, then they probably think they would use the spoke evacuator. So it was a good survey, and it kind of highlighted the fact that there certainly is room for improvement in using spoke evacuators and limiting the carcinogenic potential into the physician and the patient during surgical procedures. And I bet that this will be an interesting subject to look at in the next few years.